Today, drug maker Eli Lilly announced it plans to put a cap on the cost of insulin. Starting right away, people who rely on the drug will pay a maximum of $30 per month. Our Brandon Rue is acutely aware of this issue, being a type 1 diabetic himself, and shows us how this move could be a real game changer.
Both my 19-year-old son and I have type 1 diabetes, which means we could not survive without man-made insulins to help control our blood sugar.
Take this issue away from, a disease that's stressful and difficult to manage already. Take away the affordability challenges.
The CDC says over 37 million people in the U.S. have diabetes. Almost 1 out of 10 Americans can pay well over $1,000 a year for just insulin alone. Just today, Eli Lilly announced an immediate cap of $35 a month. That's the most anyone with insurance would have to pay for its insulin.
This new effort to reduce the cost to no more than $35 a month for insulin for all Americans. We're doing that for our products. That's what we can affect.
By May, Eli Lilly says it will drop the price of a vial of its generic insulin to $25. By October, uninsured diabetics will pay 70% less than they're paying now for Humulin and Humalog, two of Lilly's most popular insulins. Critics argue that it was companies like Eli Lilly that jacked up the insulin prices to begin with, and that this is only temporary relief, politically driven.
And so while we could wait for Congress to act or the healthcare system in general to apply that standard, we're just applying it ourselves. Lilly's going to buy down all of our customers' out-of-pocket cost to $35 at the pharmacy counter automatically.
Back in January, our federal government already applied this monthly cap to any diabetic patients with Medicare coverage. Now, you may have to work a little bit with your medical provider, insurance company, and pharmacy, just a little bit on the onset here, to make sure those who use insulin get this critical relief right now. Type 1 diabetic Brandon Rue, back to you.
Very good. Brandon, we appreciate it. And Eli Lilly plans to roll out a new 24-hour lasting insulin next month.